Hi, my name is Michelle Mosia. I'm a nurse practitioner. I'm also the program director of the Senior ER, and this is where our story begins. In 2010, St. Mary Mercy Livonia opened the first senior ER in the state of Michigan. It was here where system failures related to transition of care gaps became ominous in the older adult population. Gaps in information from ER providers to deliver care blindly. Ineffective communication provided the perfect storm. Older adults lost in a wave of poor transition can be subject to wrongful resuscitation, duplicity of care, and unnecessary, unwanted, and costly care. Complex problems required a multidisciplinary approach. These challenges were quickly addressed by a responsive number of individuals. Through synergistic influence, the team honored the Institute of Medicine goals of healthcare system that is safe, high quality, cost-effective, efficient, equitable, and patient-centric. This interprofessional team group calls themselves affectionately STARForUM, Safe Transition of All Residents for You and Me. Local nursing facilities, EMS, ER nurses, home care providers, and non-licensed healthcare professionals capitalized each other's expertise and capabilities to create innovative strategies. Some of the innovations that we did transition checklists, we did forms, we did letters, we did transition envelopes for communicating key elements needed to bridge the transition gap. These tools assist the ER providers and the EMS, who are interim providers of care, to safely execute a decision, diagnosis, and disposition in a patient-centered way. To bridge the gap in the other direction, our ER nurses now call, report to the facility. Moreover, a color-coded phone directory assisted the ER providers to correctly identify the level of care for correct disposition. And currently, this phone directory is used throughout the hospital. So how did this work in practice? Medication history improved along with last time dose given, prevented duplicity of care, missed doses, and helped identify adverse drug-related events. Proper identification through picture ID was also advised, since many patients coming from facilities are unable to articulate who they are, so the picture ID helps us to make sure we're taking care of that patient. The group also outlined process flow mapping to help identify accountability for each stage. The team also self-audits their records at every monthly meeting for transparency. So what were the outcomes? Well, partnerships improved, relationships, confidence in each other. We improved the length of stay, we improved the turnaround time, we improved provider, we improved the nurses' satisfaction, the families, and the patients. Are there any data sources or impacts that can be shared? Absolutely. We did a 47 chart review, and I can tell you that the STARForUM facilities outpaced the non-STARForUM participating facilities in the elements we need to safely take care of the patient. Moreover, this team has been very pivotal in the work of the Care Transition Improvement Coalition team in reducing 30-day readmissions in Southeast Michigan. Relationships improve between the facility as they now have a point of contact person that they can talk to if there's any other information they need to give us about their resident. A website soon will be available to share our innovation. So what lessons have you learned? The lessons that I want to share with you is send out a letter to all your participating facilities that use the ER as their 911 care provider. Let them know that you're trying to improve transitions of care. Use action research methodology so everybody works together. It's not one way. Because patient care in one site affects the care in another. Utilize their contribution. Do a lot of praise, say a lot of thank you, send letters of thank you, and make it fun.